So America's fentanyl crisis continues to take a steep toll. And tonight, a follow-up to a story I brought to you first here at 7 back in February. Maryland Governor Wes Moore here, signing a bill into law today requiring hospitals to test for fentanyl when they do a urine toxicology screening on a patient. The bill is known as the Josh Seams Act. Josh grew up in Maryland. He died last year on his 31st birthday. He spent hours in a hospital ICU after an overdose, but fentanyl, it didn't show up in any of Josh's medical charts or reports because he wasn't tested for it. Now, back in February, I hosted Josh's partner, Melanie Yates, who explained why this bill would help.
All of our overdose data, fatal and non-fatal in Maryland, comes from our hospitals. So if we're not testing for fentanyl, we're losing out on data on the biggest killer in our nation and responsible for more than 80% of fatal overdoses in Maryland in 2021.
This could potentially reveal that the problem with fentanyl is a lot bigger than any of us know about if there's additional overdose deaths that just haven't been categorized as fentanyl deaths, right?
Fentanyl deaths and non-fatal overdoses. We're talking about kids who smoked marijuana and it had fentanyl in it. They'll swear up and down it had nothing in it, and their test comes back with fentanyl.
Now, Maryland State Delegate Joe Vogel was with us for that conversation in February. He introduced this bill, and he's back with us tonight. Thanks so much for joining us. You represent Gaithersburg and Rockville. You were there with the governor for this bill signing today. By the way, this bill passed the House of Delegates and the State Senate unanimously. That's quite an accomplishment. How did you bring that together?
Well, look, this is an issue that both Democrats and Republicans see as a problem, and we brought people together, and we are the second state in the country to be able to to accomplish a bill like this that I really do believe will save lives and help us address this fentanyl crisis.
You know, this is one small thing that state leaders, including yourself, can do. Has the state tackled any other avenues related to fentanyl during this session? I mean, it's killed 5,300 people in Maryland over the last 2 years.
Well, I've been communicating frequently with leaders in our state like Secretary Emily Keller, who is the former mayor of Hagerstown, who took on this issue in Hagerstown and now has been appointed the special secretary of this to address this crisis. And we worked really closely on this bill and are working on a number of fronts because this is a piece of the solution, but we have to make this a priority for our state moving forward as well. We have to put an end to this fentanyl overdose epidemic.
Talking about the solutions, Congressman David Trone, who is in the 6th District, that's where you and I live in Maryland, he's been a leader in Congress at the federal level on efforts to, look at the mental health crisis and also to combat, overdose and substance abuse issues. I talked to him about what efforts are happening at the federal level back in March. I want to listen to a real quick clip of that, and then we can talk about it on the back end. Listen to this.
The president has put all that focus on how we deal with folks in America to help them get through this addiction crisis, which has taken over 1 million lives, now 100 and some thousand each year. 80% of those are fentanyl. So the president's all in there, but he is stymied, like all of us are, with no cooperation from China on the precursors, and then nothing from President Obrador in Mexico.
All right, so the question, do you think that there's enough happening at the federal level to try to combat this fentanyl crisis?
There's more work to be done. Right now, my focus this past legislative session was on doing everything that we could here in Maryland to get better data. Right, and this bill, what it does, and we actually added to it since we were on the show last time, to improve the data reporting process so that right now the State Opioid Operational Command Center will get timely and accurate data as to where we're seeing upticks in fentanyl cases across the state. That'll help us respond accordingly. We need data-driven solutions to put an end to this fentanyl overdose epidemic.
So we can respond to things in real time, because as of right now, I mean, you go on the internet and you look, overdose deaths. I did it a couple of hours ago. You're getting data from 2020 and 2021. You're not getting the current lay of the land.
Yes.
Yeah.
And mental health is an important piece of this as well, right? We have to be tackling this from all different points, making sure that we have the data to respond accordingly, but that we're preemptively addressing what is driving people to addiction.
All right. Speaking of Congressman Trone, there's the possibility, it's been raised, it's been reported widely, that he may end up running for Ben Cardin's Senate seat. That would open up a congressional district race in CD6 where you live. Is that something you might be interested in pursuing?
Well, I don't want to get ahead of the congressman's decision or his announcement as to what he's going to do with the Senate race. I'll say, look, I would seriously think about it for the same reason that I ran for delegate. I think we need a new generation of leadership, new ideas, new energy, leaders with courage to take on the challenges we're facing. We needed that in Annapolis. That's what I've brought to Annapolis this last in my tenure there, and that's what I'll bring to Washington if I do decide to run. But that'll be a conversation for a different time.
Stay tuned. We are sure to see a seismic shift in the congressional leadership and the congressional representation here in Maryland because of that Senate seat opening up. Delegate Joe Vogel from Gaithersburg, Rockville, appreciate your time. Thanks so much for coming in.
Thank you.
All right. So listen, by the way, if you or somebody you know struggles with addiction, there is help available. You can call the Substance Abuse National Helpline, the number right there, 800-662-HELP. It is free and available 24/7. We will be right back.